Okay, hello. This is Dr. Bill Bird. I'm the CMO here at CGH Medical Center in Sterling, Illinois, and other parts of which we're in one of those other parts. We have Dr. Matt Wolf with us today, and Dr. Wolf is a family practice doc here in the Morrison office as well as the Prophetstown office. So welcome.
Thank you for having me. Appreciate it, Dr. Bird.
Yeah. You know, this office is kind of near and dear to me. I I used to have my sign on the
Your name on the side.
Yeah, I did. It's gone. But yeah, back in the day.
Did you hang that on your wall? Did they give it to you?
No, I think I just threw that in the trash. It's all gone. It's gone. All right. So anyhow, enough about that. Glad you could join us, whether you're listening live or going to take this in later. As always, as we have conversation, please feel free to send in questions that come to mind and things that come up. I have, of course, as usual, I have some questions for Dr. Wolf, but Dr. Wolf is really up on this kind of stuff as well, so it would be fun to kind of chat about the questions that you have about the pandemic and everything going on with it. And I think I'll start with, I think you sent me a question the other day, Rebecca, didn't you?
Yes.
Yeah, so there was that there was some type of, I don't know, cover-up in a sense that people don't want to give hydroxychloroquine.
Mm-hmm.
You want your spin on that, Matt?
Yeah, I thought I'll be honest with you. I didn't have a chance to watch the full video, but I've caught kind of the highlights of it and get the gist of it a little bit. And my understanding of it was a group of doctors that came out and said hydroxychloroquine. And you know, it's very confusing, I know, from people trying to digest the information that you see online, because there are a few studies out there that have shown some benefit of hydroxychloroquine. Unfortunately, at least from what I've seen, some of their methods were a little suspect. I believe that one of the big studies was done on a Henry Ford, and I'm sure they were really gung-ho, and I would love for them to found a cure for it, and they did find some advantages. However, they didn't do what's called a double-blind study, where the people administering the medications don't know what medication they're given and don't know.
Yeah, that's the gold standard study you're looking for. It's called a double-blind, where one group of people get the treatment and one group will get a treatment, but it's not that one. It's what we call a placebo.
And the people giving it don't know who's getting what.
Correct.
So they can't let their personal biases shine through. So those haven't really been done.
Yeah.
And so, as of right now, it doesn't look like hydroxychloroquine is the cure we'd hoped it would be. I mean, Dr. Bird and I would love for there to be a great cure for COVID-19 out there. And it does appear that face masks work. So I was a little bit disheartened to see that video in wide circulation. Unfortunately, I think it missed the mark a little bit, in my opinion.
Yeah, I think that my couple comments on that would just be that, time will tell on this hydroxychloroquine and any sort of treatment of this virus. I would say right now, I read an article in the New England Journal of Medicine, which is like if you were to have it's a gold standard in terms of medical journals. And they did one of these studies that Matt's talking about, and felt like there really wasn't any difference between treating with that medicine versus treating with placebo. But time will tell on that. I think the thing that I would say about those kind of videos when I watch them is the undertow is a little bit that there's some sort of conspiracy, and that someone somewhere wouldn't want patients to take a medication if it was helpful for them in the medical community and or government. And I struggle a little bit with that kind of thinking. I think most of the folks that I see are trying their best to come up with whatever they can to help patients out, and at the end of the day, that's what they're after, whether that be masking or hydroxychloroquine or whatever. And so that part of that tone of that, I didn't care for that part of it. The science of whether or not hydroxychloroquine will be helpful, okay, I'm open to that. I mean, we're all learning through this process. That would be my comment too.
I agree. There's nothing physicians hate more than a problem without a solution. So we want it just as bad as everybody else.
Oh man, yeah. Okay, so while I'm waiting to see if there's any more questions as a result of that, I am going to kind of...
Bothers me that I don't know what happened to these patients. There's no longitudinal care with it.
Okay, so yeah, we're back. We hope you had a good time there and kind of did your hair, whatever else needed to happen, and we're back. And let's get at it again. So I think we were talking when we lost connection there about your interest in the rural side of things. So I'll let you start that question again, Matt.
Yeah, I grew up in Erie, so the rural community is all I ever knew. I actually went to medical school in Chicago. Quickly found out that wasn't where my passion is. I was always more of a small town person than a big town person. I remember when I started medical school, I was walking down the road with one of my friends who grew up there, and I waved at a stranger, and he looked at me like I was crazy. So I realized that small towns is where I belong. So came back, was fortunate enough to be given the opportunity to practice rural medicine, and enjoyed every minute of it.
Yeah. So in the clinics that you work with, and the nurse practitioners that work there with you, anything new, exciting going on at those clinics?
Yeah, I think we've actually had a lot of new, exciting things kind of go on with those clinics. Like I had said before, here in Morrison, Cassie just started early this year, so she's getting up and running. That's exciting. In my Prophetstown clinic, April's getting up and running. That was just last month, so that's really exciting. Now in Prophetstown,
Hi, April.
We're able to offer availability 5 days a week to that community, so that's a great service I think that we offer. In Walnut, they just went through a fantastic remodel.
That's right, yeah.
Did some updates, so they have little nicer facilities. They're able to serve their patients a little bit better. That's really exciting. And our clinic in Fulton is still pretty new. Just opened up late last year, early this year. I forget the exact date. I just remember it was really cold for the open house. And 2 providers there, Lynn Coffey and Kimberly Teets Garrison, and they're doing a great job growing their practices, a lot of availability too. So on the rural side of it, I feel like we're providing a lot of great opportunities for our patients to have availability to healthcare, and accessibility to healthcare, so that we can make sure everybody's taken care of.
Yeah, I mean, if you draw a circle around the hospital, around CGH, most of these smaller communities we have, yeah, and you're a big part of the western and southwestern.
CGH West, I'm going to sign name.
Something like that, yeah. So when you're not reading studies and doing medicine and mentoring nurse practitioners, what do you do when you're just hanging out?
Then I mentor much smaller people. I have a 4-year-old and a 2-year-old daughter. So
Okay.
yeah, they certainly keep me busy. Obviously, watching them grow and spending time with them and my wife is what I enjoy doing with as much of my spare time as I can get.
Sounds good. Do they have favorite shows that they like to watch with you?
Yeah, that'd be the Puppy Dog Pals right now. Is Puppy Dog Pals. Don't make me sing the jingle.
Go ahead, let's hear it.
That's all right. Sorry, nobody wants to hear that.
Okay, good. All right. Oh yeah, I was going to ask you about okay, here's a question that popped up. How's the hospital doing with all the new cases? Hopefully they aren't severe and can recover from home. Yeah, I think I mentioned this the last couple times that we had a period like, gosh, it seems like it was like late May, early June when we didn't have anybody in the hospital with COVID for like 2 or 3 weeks. And unfortunately, since that time, it seems like we always have between 1 and 3 patients in the hospital that have COVID. So that's kind of where we're at right now. We're fortunate. We're not like the big city or some of these places that you read about where they've really surged up, but we've never really cooled down either. It's just kind of this ongoing stream of folks that are there. So yeah, and I think the thing that I think what's been helpful is that in this rural community, the incidence hasn't been, I mean, in Whiteside County, we've had probably more than, if you look at our color on the map, we're a little more robust than some of the real rural counties in Illinois are. But yeah, I always say this, but I appreciate anyone out there who is doing all the stuff that they can do to try to protect themselves, and protect others, because ultimately the fewer people that get sick, we know out of 100 people that get sick, you know, was it, I don't know, 5 to 10 of them are going to end up either hospitalized or hospitalized in the ICU.
Mm-hmm.
So that it's just a numbers game. The fewer people that get the infection, the fewer people that end up in the hospital, and then the fewer, people that get really, really sick. So appreciate all of you that are doing a good job with that. Okay, so there's a thing that came out a week or two ago from the World Health Organization, or WHO, and they were talking about their concern is actually that delayed childhood vaccinations may end up being a bigger deal long term
Absolutely.
than this pandemic.
Absolutely.
What do you think about that, and what like here in Morrison and in other places that you're part of, what are you guys doing to try to help out with that?
Yeah, that's a great question, and I believe the American Academy of Pediatrics had a similar statement with their concern on kind of guidance for those of us that see children, what the most appropriate thing to do is. It's interesting. Everything we do in medicine, I think, has a risk-reward component of it. So sometimes we have to look at what is our benefit versus what is our risk. Here, I think, at CGH in general, we're doing a really good job trying to really mitigate the risk to our healthy patients to stay away from our patients who potentially might have COVID. That's really where it starts. So we are still recommending that the children that come and see us get their childhood vaccinations on schedule, and we're trying to provide as safe of an environment as we absolutely can. How we're doing that is, number one, any patient who we think might have COVID, unfortunately, are all routed through our Ready Care clinic, as I'm guessing Dr. Bird has probably discussed in previous videos, so that we can kind of keep those healthy people healthy. We do temperature checks at the door, and the last thing my clinics in particular really try to work hard on is not keeping people in the waiting room. It really seems like as our science evolves and our studies evolve, that most spread of the virus is person to person. So you're in too close to physical contact to somebody who's unfortunately infected. And so if we can do our part to not get people in close quarters, that's what we're doing. So if you walk into one of our clinics, one thing you will find the vast majority of the time is you are not going to sit in the waiting rooms very long. So that you are very unlikely to run into the person who comes in after you. That way we can continue to provide services like childhood vaccines, because they're very, very important. A lot of preventable diseases we don't want to see starting up again. So we're still trying to keep the kids on schedule, and there's been some other kind of offshoots of that for adults as well. I've seen some studies by American Cancer Society is worried about the same thing for cancer screenings, that we're delaying those too much. And I think the other thing we have to remember is our views at the beginning were probably different than our views now. At the beginning, we had some experts that were definitely telling us, hey, this thing's going to be around long term, but I don't know about you, Bill, but I was hoping they were going to be wrong. And so when we kind of closed things down, I think we were all saying, well, let's stick our head in the sand a little bit, and if we can just ride this out, we'll come out the other end. So you know what, if we put off that vaccine for a month, or we put off that colonoscopy for a month, or the low-dose CT screening for a month, it'll be fine, because we'll just get it next month. Now we need more of a long-term plan. And those, those screening tests and those vaccinations, preventative health care are still very important. And so we're taking all the precautions that we possibly can, but I think we are emphasizing still how those things are important, and that routine health care still needs to go on.
Yeah, that's a good point. I would clarify one thing about Ready Care, because we do have some questions about this, is our Ready Care, just their ability with both the testing that they have and the staff that they have. What we're asking those folks who want to utilize them is, Ready Care is a good fit if you have symptoms that are concerning for COVID, or if you're an essential worker, let's say you're a healthcare worker or something like that, and you've been exposed to someone who is positive for COVID, then we want you to go to the Ready Care, and we want to take care of you there, and we'll do the testing we need to do to help you out. If you don't have symptoms, if you're asymptomatic is the fancy term for it, and you've just been exposed potentially to someone, or concerned that you might have it, but you're not symptomatic and you're not an essential worker, we would ask that you go to the health department, and the Ready Care will direct you to the health department, not because that they don't want to be able to help you out and do that, but in terms of the testing supplies and the staffing that we have, it just isn't a fit to try to do that. So I just, for those of you who are listening and will be listening to this, if you can just clarify that with your friends and family, if that comes up, that would be really helpful, because about every week that comes up. Yeah, so I'm glad that we talked about that.
Absolutely.
All right. What else did I have on my list? Oh, yeah, okay. Do you have any special areas of interest?
Other than rural medicine, not really. And that's why I love family medicine. People close to me would probably tell you I have a short attention span. So I like to be able to do a lot of different things. And luckily in family practice, we get to do a lot of different things. So,
yeah, this is true.
It keeps us on our toes, and just, the variety of it is why it's so exciting.
So what would you say, like, every job has a side that, like kind of that dirty underbelly, or whatever, dark underbelly. What would you say the dark underbelly of family practice is?
I thought you said you didn't want to talk about the conspiracy theories.
Oh yeah, no, right. Not conspiracy.
I'm just
more of the, oh, really? That kind of thing.
I think the same thing probably most physicians would say, and that's just getting our patients the care they need when we think we need it. There's always, I don't say always, but there's often a disagreement between what the provider thinks somebody needs and what they're able to get due to insurance reasons or costs or things like that. And so it's frustrating sometimes when you think you've laid out a treatment plan that's best for your patient. You want nothing more for than to stay healthy or get better, and you run into some roadblocks just due to some costs or some pre-approvals, things like that.
Yeah, everyone says the same thing, so I'm just
Yeah.
confirming that. Yeah.
Yeah.
So what would you say the most satisfying thing that you do about what you do?
Definitely following people longitudinally and building relationships with them. Just kind of meeting them, meeting their family. There's, in my opinion, no greater compliment than when you meet somebody. They establish care with you as their physician, and they say, hey, you know what, would you see my kids, or would you see my dad, or I think you do a pretty good job, and that they trust you with their health and their family's health. That's an awesome thing that I'll never get over. That's just great.
I would say that's the one thing I miss about being in an office like this.
Absolutely.
Yeah, absolutely. So when you think about this pandemic and that's ongoing here, what would you say your biggest concern is right now, Matt?
I think it's really going to be our vulnerable populations. I normally, for the last several months, I've started almost every patient encounter the same way. And that's just, how you holding up with the pandemic, with all the rules and regulations and isolation, and how is that going? And one thing that I've really noticed is that we have a lot of people who, might be a little older, who are pretty concerned about it when they go to the grocery store and see people not wearing masks. It makes them, kind of fearful for their own health, their own health, and those are the people who really I want to protect, because they're just statistically the most likely to get the severe disease. And so every time I see them and they tell me that, it makes me worry about them a little bit, and just hope they're staying safe and hope that everybody's pitching in a little bit to help keep them safe, because the fact is, it's darn near impossible to stay in 100% social isolation. So even they often have to go out because there's nobody to bring them food, and so they might still go up to the local grocery store, and I worry about them. That would be it.
Yeah. And speaking of that kind of the mental health angle on that, I just for next week, I'm going to have our Ways to Wellness person, Christine Romsberg, who's going to join me to kind of talk a little about mental health. So just as a kind of be aware for next week, that's what we're going to be talking about. There's a question here: are you allowed to prescribe hydroxychloroquine?
I don't know of any law that prevents it.
Yes, we are. Yes, we can.
Yeah.
So, Matter of fact, it was, I mean, not as much anymore, but boy, it was a very commonly prescribed medication for people that had some of these like rheumatoid arthritis or psoriatic arthritis or psoriasis or all these kind of things. So yeah, and even now it's, I mean, some for malaria and that kind of stuff. So.
Yeah, there's very few true laws preventing a physician from prescribing anything for any reason they want to, but we try to go based on the best medical science we have at the time.
Yeah. So yes, the answer is yes. We can. But for this condition, if the follow-up to that question is, for this condition, would you prescribe it? Not right now. Yeah. I don't think I would. I would be open, and by the way, the hospital still has some of this remdesivir. Mm-hmm. I would be open if there was a patient that was admitted to the hospital or prescribing that medication. Mm-hmm. And I would be open to the convalescent plasma, which we've given to some patients in the hospital. So there are things I would do. Right now, that wouldn't fall into that bucket. So yeah, I wanted to talk about that remdesivir just so that folks would know that. And someone asked about our numbers. Do you want to read the numbers in the back?
Oh yeah, absolutely. And these are yesterday's numbers.
These are yesterday's. I think we've added a couple of cases since yesterday.
1 in CCU, 2 and 3 East.
Well, I'm talking more about the total numbers.
All right, I'm sorry. Total number of tests, 2,749. That's 126 positives and 2,485 negatives.
So I think we're about 128, 129 positives now at the hospital. And obviously the hospital is not the Whiteside Health Department, so obviously there's a bigger number just overall in the county, but that's our numbers right now. A couple other things. Well, I typically do a. Okay, so has it or has it not been prescribed for 65 years? This hydroxychloroquine, quite a while.
Yeah, a long time.
Yeah.
Yeah, a long time. Not for this, but
yeah,
but a long time for various conditions. Yeah.
Okay, keep coming with that question. I think it's the same person that's trying to get somewhere with that, and I'm willing to keep answering. So, all right, I just wanted to also mention that I typically give a shout out to someone here in the hospital, and I was just talking to a group today and realizing that we have a group of folks that are kind of behind the scenes that are really helpful, and it's called our central scheduling department. And our central schedulers schedule. So when you're here at Dr. Wolf's office, and Dr. Wolf says, I think you need to have an MRI of your neck for your neck pain. Our central schedulers get a call from the office, and they get it all set up and get you all plugged in and get you taken care of and ask the right questions and do some kind of the back end work that allows you to get that done and get that covered and all that kind of stuff. So Shauna Kramer's the manager there, and she has a really good team, and just wanted to say thanks to them for the hard work they do. There's a lot of moving parts when it comes to different tests, procedures, you name it, being done at the hospital, and the central scheduling has a big part in all of that. And I always give our docs a chance to kind of give shout outs to their teams that they work with.
Everybody on my team's awesome.
All right, good. No one in particular, no.
Then I'll forget somebody. So everybody. The team is awesome.
Okay, I'm saying. Well, I want you to tell me all the people that work on it. All right, good. All right. So, I did want to make sure there's that person that was talking about the 65-year thing. Okay. And I think there's one other thing that I think is going to come up in the next week or two that we might be talking about, and it's about school starting and that kind of stuff. Mm-hmm. And I saw an interesting video on YouTube. It's under a thing called MED, M-E-D, and the last word is CRAM, C-R-A-M, and it's about COVID-19, and it was about something called CT levels, capital C, capital T levels. And it talks a little bit about some of these not as quite as accurate testing as maybe there might be a role for them when school's open. So that may be something that we talk about in the weeks to come. So just something to take a look at. Time will tell on that. There's more of I guess that was more of just like a teaser that might be coming
Stay
down the
tuned.
road. Yeah, stay tuned.
Next week's
Come
preview.
back. Yeah, we'll maybe talking about that a little bit more. This is a Love Dr. Wolf.
Uh-oh.
Yes.
Your check's in the mail.
Thank you for all your concern and care for your patients. You are very much appreciated. So, I agree with that person. Yes. I
You have to.
agree.
You're my boss.
Oh, all right. So, hey man, it's been good chatting.
Thank you for having me. I appreciate it, Bill.
I always appreciate the folks who listen and send this out, and we're trying our best just to keep all of you in the loop and tell you what we know as best we know it, as we know it, and as things change, we'll keep giving you that. And I love the fact that we have some great folks here at the hospital that I've been able to talk with, and we're going to keep talking to those folks. Like I said, next week we're going to talk some mental health and kind of go through that along with other things, but that's going to be the focus next week. And I think this whole month we've got some really interesting folks that we're going to be talking to. So thanks for listening. Thank you, Dr. Wolf, for being part of this, and we'll talk next week.